Hi, welcome to this hair care initiative by IPTA. I'm Moona Sharma, and it's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a crowning glory and it makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, it used to be a sign of middle age problem when you used to lose hair or have bald, patchy hair. However, with increasing pollution and the increase of stress in our daily work life, we are now seeing hair problems occurring at a younger age. It is not uncommon now to see 25 to 35 years old people complaining about hair problems. Most of these problems, if identified early, can be managed well, and much of the hair loss can be avoided. Today we have with us Dr. Archana is a well-known dermatologist and has been practicing medicine for over many years now. She's MBBS MD, specializes in dermatology, cosmetology, and trichology. She's currently practicing at her own clinic, Tricare, Hyderabad. Dr. Archana has dedicated her career to diagnosing and treating a wide range of skin and hair condition by providing personal hair care services to her patient. She takes time to listen to her patient concern and work closely with them to develop a treatment plan that meets their individual requirement. Dr. Arjuna is also aware of the need for the patient education and awareness about hair care and spend a lot of time in giving talk at various platforms across the country. Thank you so much, Doctor, for sparing your valuable time to answer a few questions on hair care for us today. Welcome to
Thank you
this
for your kind
interview.
introduction. Thank you.
डॉक्टर हमारे साथ जुड़ने के लिए बहुत बहुत शुक्रिया सो टुडे वी आर गोइंग टू टॉक अबाउट हेयर केयर इन करंट सिनेरियो सो whenever we talk about hair care in current scenario the very common problem which is faced by all of us is hair loss irrespective of gender and age so can you please enlighten us with your profound experience like what's normal and when to be concerned for.
Yeah, sure. So most of the trichology cases that we see in the clinic would be of hair loss. A lot of people ranging from all ages do come in seeking help for hair loss. So it's not very specific for an adulthood. It's even the teenager problem now, adulthood, or even in the late 50s, 60s, people do end up in hair clinics complaining about hair loss. So what is normal hair fall and what is hair loss?
Mm-hmm.
So normally we are to lose around 50 to 100 hair strands. That is considered as normal hair fall. So whole time it's not like the hair is always in the growing stage. There are multiple stages in hair growth. It's called a hair cycle. So hair will be in growing stage. That is almost 80 to 90% of the hair strands on our scalp will be in the growing stage. There is a stage called transition resting stage where around 10 to 15% will be in this stage. Post
Mm-hmm.
this stage, the hair keeps on shedding. So around 10%, that is around 50 to 100 hairs that we lose every day, we take it as common. There are seasonal variations also, like during the winter season, there is a little extra shedding of hair. So that is also considered normal. When we are losing more than this, where everywhere we do see our hair strands falling, then it's a concern. There is reduction. You as a patient, you notice that is there is reduction in the hair density. That your volume, or your ponytail volume, or the once you hold your hair strands, you feel okay. The volume is coming down. That's when you have to be worried about your hair fall. There are other reasons. It's not just you keep losing hair strands and the density is reducing. There are multiple other conditions that can lead to hair loss. That could be a few medical reasons, causes like alopecia areata, where there is patchy hair loss. That could be one of the concerns. There is baldness. We see a lot of male pattern baldness. That is, there is recession of the hairline. Hairline is moving back. Your temporal corners are becoming more deeper. You're losing hair over your crown area. The density is reducing. Then it's better you consult your dermatologist. They would be a better person to advise on how to take care of these things.
Okay, that's very interesting, doctor. So, doctor, like now that we know, like, what is hair loss and what are like different ways of knowing that you have a hair loss problems, but what are the general causes? Like, people keep asking, why me? Why it is happening to me? What are the general causes of hair loss?
Again, coming to causes of hair loss, there are multiple causes. One is more commonly what we see is genetic hair loss.
Hmm.
Around 50% of men, around by the time they reach around 50 years, there is a genetic pattern of hair loss that is going. So, someone in your family would have a hair loss. It's not just one generation we consider; it's the multiple past generations that you have to take into account. So, in this kind of pattern hair loss, what happens, as I said already, the hair over your crown area starts reducing. the density around your temporal area, that is over the corners of the forehead, there you will start losing hair. The hairline keeps moving back. This is a kind of pattern balance. So it's not just specific to men, it can also happen in women. Where in women it's slightly different. It's like hairline is maintained well. It's only over the crown area, the density, the mid partition starts becoming more visible. This is a kind of, again, a genetic hair loss in female pattern. Other causes would be your crash diet, trying to lose a drastic weight. You're not giving a proper protein or healthy balanced diet, you're not maintaining. Your lifestyle, excessive smoking, alcohol consumption, the pollution, the stress you're taking, your sleep disturbances, all these leads to hair fall. Other causes would be like fever. Your it's not like immediately you get fever and you start losing hair in the next few days. It's your past, like around 2 months or 3 months, you had a severe fever where like dengue, malaria, typhoid, all these things also leads to something called telogen effluvium, that you start losing hair because of these fever. There are nutritional deficiencies like vitamin D deficiency, iron deficiency, multiple other micronutrients, what we call. So like calcium is deficient, vitamin C is deficient, vitamin E is deficient, zinc, selenium, multiple minerals, vitamins, proteins, all these deficiency also leads to hair fall. Other thing could be your hormonal changes like your thyroid disorders. It could be your PCOS, polycystic ovarian syndrome or disease, which is present, that will also lead to this. One more common cause would be post pregnancy. So what happens due to a lot of hormonal changes during pregnancy, you would have grown really good hair. That is, the growing stage of hair is much better during pregnancy. So once you deliver, again the hormones are coming down. The whatever used to push the hair towards growing stage is withdrawn back. So that's when during the postpartum period, that is post-delivery period, you'll start losing hair. This is one more very common cause. Other things would be the medications you are taking. Like we see a lot of cancer patients with chemotherapy, radiotherapy. There are a few. It's not just this. There are people who think the hair fall will happen and they take a lot of supplements. So even excessive supplements can also lead to hair fall, like hypervitaminosis. You are taking vitamin A in excessive amount. You are taking biotin in excessive amount. All these things can also lead to hair fall. Coming to children, in children we see malnutrition, like they're not eating well, there is a protein deficiency, there's an energy deficiency. So even in children we get to notice hair fall. It can be also due to few genetic factors in them. There will be a few genetic mutations that have happened that can also lead to different kinds of hair loss. So coming to different kinds, again there is whatever we spoke till now, it's all like non-scarring alopecia, where the hair loss is happening and at a proper time you seek some medical advice, you take treatment, it can be reverted back. There are few other conditions like cicatricial alopecia, what we call, that is scarring alopecia. There are hair follicles which are getting permanently damaged. So that can be due to autoimmune disorders like discoid lupus erythematosus. There can be lichen planus pilaris. So in these conditions, what happens? There's some inflammation destroying your hair follicles, so it can't grow back. So in these conditions, also you're supposed to seek medical advice. So the doctors, we do biopsy, we take pathological report, we consider all other things, and we start medications as early as possible, so the destruction can be stopped. So at least whatever hair you're already having can be saved.
And that's very interesting, doctor. So, doctor, nowadays we are all having a lifestyle like which is very pretty busy, and whatever we get, we just eat it. We don't see the nutrition level. And you also said that nutrition is also important. So, can a person lifestyle play a role in hair health?
Yes, for sure. So lifestyle, the competitive lifestyle has become so competitive that we are so stressed with the work environment, we are so stressed with the family thing, we are stressed with time management. So all these leads to again compromise in your homeostasis, what we call. So again, your nutritional intake is not proper, not proper healthy food. Like including all balanced food, what we call, like fruits, vegetables. If you're a non-vegetarian, including meat, fish, egg, sprouts, dry fruits. If this is not done in a proper way, we are all towards now ready-made food, eating a lot of junk. So where we're not getting proper nutrition. This will also lead to a lot of hair loss. Again, because of stress or other reasons, alcohol consumption, you're smoking. So, yes, obesity, sedentary lifestyle. All these leads to a lot of disturbance in the hair cycle, which leads to hair fall.
Okay, that's very interesting. So, doctor, now that we know that what is hair loss and what are the causes and even the lifestyle is important. So, another very common questions and people are confused about it because there are a lot of information about this treatment. Like, so what are the medical treatment actually available for the people with hair loss, like surgical or non-surgical or any other treatment is available to manage the hair loss?
So, when it comes to the treatment part, it depends on what kind of hair loss and what's the diagnosis made by the dermatologist. Okay.
Mhm.
So, when we consider genetic kind of hair loss, that is patterned hair loss, what we call. So, in that, the mainstay of treatment would be topical minoxidil. Okay. So, most of the people are very aware about topical minoxidil now. People are doing self medication with topical minoxidil. So they're not aware how to use it and for how long it should be used. Yes, topical minoxidil is available in 2%, 5%, 10%, even on higher concentration like 12% also. So for how long you're supposed to use this topical minoxidil? It's almost like when there is a pattern hair loss diagnosed, it's almost like a lifetime treatment. It's you have to make it a routine that you apply your topical minoxidil minimum twice a day. So what does this do? This increases the vascularity of your scalp. There is a lot of extra nutrients which is being delivered to the hair follicle. So hair growth happens in a good way. It what does minoxidil do? It increases the lifespan of the hair also. So it increases the growing stage of the hair. Okay. So for you to see results, it at least takes minimum 2 to 3 months for you to start noticing the results. So before that, you're expecting anything out of it? No, you can't see anything. There's a little increased shedding also, which can happen during first 1 to 2 months, which is very normal once we start you on topical minoxidil. So it's like a year or two that you have to keep on in using minoxidil. At least by the month of 6 or 7, you'll start noticing, yes, there is very good results. There is increase in hair growth. There is density is increased. The texture of the hair, whatever thinned out hair, has become a little more thicker now. So if even after using it for a longer period, you feel okay, it's not working on you, then please get back to your dermatologist. There are multiple other medications. Sometimes what happens, the enzyme required to convert this minoxidil into active form is deficient. Maybe it may be deficient. So a lot of minoxidil boosters are available now, which is a new thing in the market. So maybe if you're deficient in that, a doctor can do a test for that and add that booster, minoxidil booster to you. So coming to other kind of treatment, there are multiple oral medications are also available, like finasteride is available, dutasteride is available. There are multiple micronutrient supplements has to be taken, because when we are talking about hair growing, once there is a hair loss or hair shedding, once we are pushing your hair towards growing stage, there's a lot of nutrition required for that hair to, like the cells to multiply. You need energy, so that energy also has to be supplemented through dietary allowance or through oral supplements. Okay, coming to other kinds of, these are all medical line of treatment. There is one more thing called topical finasteride, which is can be used in men in pattern baldness. Coming to female pattern baldness, there are multiple other oral medications along with topical minoxidil, like spironolactone, cyproterone acetate, and hormonal replacement treatments, etc. Okay. So coming to other kind of modalities of treatment, what we call non-surgical modality, but not a medical line, procedural dermatology, where PRP, platelet-rich plasma, which is, people are very aware about this also. So this is kind of treatment where we draw your blood around 16 ml, process it, inject it. So how does this act? This has a lot of platelets. So platelets has a lot of growth factors in it. Again, this increases the hair growth by increasing the growing stage of the hair. So the density increases, the texture of the hair also will change. Other types are, other treatments would be low level laser treatment, There are mesotherapies available where you don't want to take medications in the oral form or topical. There are multiple mesotherapies that is given to the local environment. Only you're losing hair over your scalp area, so we'll inject those ingredients only to the scalp area. Something like PRP only, it will be like other medicines like dutasteride, or it can be in the form of minoxidil. There is oral minoxidil also now available. So people who doesn't want to apply topical minoxidil every day, they can't carry out that procedure morning and night. So for them, oral minoxidil in a lower doses. This is also giving very good results. So coming to, okay, all these things we have tried and tested, it's not working out on you. There is a density loss. Then there is a surgical treatment in the form of hair transplantation. So coming to hair transplantation, there are multiple methods again, like there is a FUT method, FUE method. So it depends on your donor area and which grade of hair loss you're in. If you're already in grade 6, grade 7, where you've lost a lot of hair, there is no density, and the donor area is deficient, we can't take you up for a hair transplant surgery. So it's around like you're in grade 3 to grade 5, around where donor area is also good. Then we can consider hair transplantation in such kind of people. Okay, all these things are ruled out. Like you're in grade 6, grade 7, nothing is working out for you. There are non-surgical treatments like hair pieces, wigs, all those things can be used. Or there are camouflage techniques like scalp micropigmentation, which can be done. Hair fibers can be used. Yes.
Okay, so there are like wide varieties of treatment
Wide,
available,
yes.
but it's always
Depending
better.
on the kind
Yeah,
of hair loss,
the root
grade of hair
cause.
loss.
Yeah, instead of becoming your own doctor, it's always better we go to the doctor, find the root cause,
Yes.
and then get the treatment. So it will save our money and time both. Okay, that's very informative, doctor. So, doctor, like there is one word called nutraceutical, which is getting a lot of focus nowadays. Like everyone is talking about this word. So, what is this, and what's the role of this nutraceutical in hair health?
Yeah, nutraceuticals again, it's like a oral supplements that we put on patients. So it can
Mhm,
be, so how does this help the
mhm,
patients? It has all kind of anti-inflammatory, antioxidative effects. So this can be in the form of curcumin, saw palmetto, vitamin D, vitamin C. All
mhm,
we see ashwagandha, millet seed extracts. We see all this flaxseed extracts. People are already taking these things. So how does
mhm,
these help? There's
mhm,
something called oxidative stress which will be happening around the microenvironment, around the hair follicles. Okay, so there is minimal inflammation going around, maybe because of dandruff or many other causes. So
mhm,
all these can be reduced through these nutraceuticals. So these
mhm,
nutraceuticals, what it will do, it reduces the reactive oxygen species which is present in the microenvironment of the hair follicle. So once these are reduced,
mhm,
the follicle regression, what we call, because of the
mhm,
oxidative stress, there is a lot of inflammation going on. So follicles, hair follicles
mhm,
starts regressing. Instead of growing new hair, it starts
mhm,
becoming more regressive and start becoming fibrous. So all these can be prevented through nutraceuticals. It also to some extent helps in blocking the DHT, dihydrotestosterone, what we call, that is the active form of the hormone which causes a lot of hair loss. So these
mhm,
can also be blocked to some extent using these nutraceuticals.
mhm. Okay. That's very informative, doctor. So, doctor, like there are so many herbal and also there are like plant extracts like grape seed, omega-3 fatty
Yes.
acids, and phytoconstituents. So, are they really helpful in promoting hair growth or managing alopecia?
Yes, they do help reducing hair fall, hair loss, and also helps in increasing the hair density. The same mechanism here also, they are
Mhm.
reducing the oxidative stress which is going on. Hence, the hair starts growing better.
Okay. Okay, so doctor, like through this platform, can we enlighten people? Like there are like so many nutrients, and people don't know how to take those nutrients and what are
Yes.
important and what are not important. So, like what are those micro and macronutrients through which we can design our plate and eat those in our daily dietary guidelines? Can you please enlighten
So,
us?
yeah. So coming to for mainly for hair health, we
Mhm.
require iron stores. Mostly Indian women, we are very less in iron stores, that we call it as ferritin levels. Okay.
Mhm.
So this can be due to multiple reasons. One is excessive bleeding towards your menstrual cycle, or your
Mhm.
absorption pattern is not good, or you're not including the adequate amount of iron in your diet. So while
Mhm.
iron, vitamin D, vitamin B12, selenium, zinc, all these things play a very major role in having a proper hair health. So
Mhm.
all these, if once you consult your dermatologist, we usually get a hair profile done with all these serum ferritin, serum vitamin D, B12, your thyroid profile. All these things can be checked when we diagnose, okay, you people, the patient is deficient in these things. Then
Mhm.
we'll put them on oral supplements of these medications. Depend on how deficient they are, it can be given in the injectable form or it can be given in the oral supplements.
Mhm.
So, what are the other supplements other than iron, vitamin D, and vitamin
Right.
B12? That folate can be given, selenium, zinc. So, all these calcium, vitamin C,
Mhm.
vitamin E can be added.
Mhm.
Myoinositol can be added.
Mhm.
There are multiple other things like millet seed extract,
Mhm.
flaxseed extract, grapeseed extract, omega fatty acids. So all these things
Mhm.
can be combined. There are multiple oral supplements uh, available with all these combinations with like recommended daily allowance, what we call. It's not to be taken in a very high quantity, or at least there's a minimum basic daily allowance of these oral supplements available, so that accordingly it will be prescribed for the patients.
Mhm. Okay, so doctor, like the people, what people do is they just, uh,
Mm.
buy the products and eat it by themselves. And
Yes.
people nowadays there are so many gummies, they just pop it.
Yes.
And so, is it required to take these nutrients as per
No, no.
gender requirement?
Yeah. So that is usually this hair gummies, which is very popular now. See, it
Yeah.
depends. Again, there is a gender difference also to be done. There are multiple things
Mhm.
like saw palmetto I spoke about.
Mhm.
It's yes, it's prescribed for the men. Again, if a female is taking, what happens? Usually in general is nothing, but if you're
Mhm.
pregnant,
Mhm.
so what does this do? This it's unsafe during pregnancy. So there is
Mhm.
a gender difference which has to be taken care of, and
Mhm.
all these hair gummies, there's not fixed whatever FDA approval has to be taken, or a drug this amount of supplements has to be given. So
Mhm.
that percentage or the uh, yeah, percentage of the medication is whatever supplements we are giving, it's not maintained well. So it's better you take a dermatologist or a trichologist
Mhm.
recommendation and then start with this medications. And for how long you're supposed to take it? You just take it for a
Okay.
month or so, no, it doesn't help. You have to take it for a little more longer period, at least for 3 to 4 months. Then only it starts working on you.
Okay. Okay, that's very interesting, doctor. So, doctor, after hair loss, there is one another very common problem which is faced by all of us is dandruff. So,
Yeah.
can dandruff also cause hair fall?
Yes, dandruff can also cause hair fall. Dandruff, there are again, it's one of the main cause would be fungal. So
Mm-hmm.
what happens? There's a lot of inflammation going around the hair follicle, which starts loosening your hair. So there is a hair fall happening. So until and unless we stop this dandruff by putting you on some antifungal shampoos, uh, and controlling this inflammation, the hair fall doesn't come under control. So yes, if
Mm-hmm.
you are facing with dandruff, please consult your dermatologist. It depends on how much dandruff you are going through. If it's mild, again, or just a topic, just a shampoo would do, or a stay-on lotion would do. If it's very severe, then probably oral antifungals has to be given. There are multiple other kinds of shampoos like anti-inflammatory shampoos where it contains a little steroid shampoo kind of thing to bring down the inflammation. Yes, this would also be helpful.
Okay, that's very interesting. Also, doctor, there is another very thing is whenever we have dandruff or any hair fall, our mothers are always like, apply your apply oil, and they'll also ask to apply a lot of oil and get the champy and all, and they will say your hair will grow thicker and stronger. So, what's the fact behind this? Yeah, oiling hair is a boon or a ban?
See, it's when you have dandruff, it's surely a bane because again, as I said, there is a fungal element which is present in dandruff. So when you're oiling your scalp,
Mm.
you're giving food for those fungus. They start growing better in that condition. So
Yeah.
you're giving a very good environment for the fungus to grow well, and this increases your dandruffs. Oil, already there are a lot of oil glands on our scalp which is present that produces whatever oil required for moisturizing the scalp. That's more than enough. You need not have to apply an extra oil. If you really find okay, you want to apply oil, you can just do it to the tip of your hair, which moisturizes the hair. That's it. There's no need to apply oil on your scalp, which will worsen your dandruff.
Mhm. Okay. So it's nothing. It can just give you a conditioning effect. It's nothing. It can
Yes,
promote
it's
growth.
just a moisturizing condition.
Okay, so doctor, like we have talked about lifestyle, we have talked about nutrition, and one more another problem is that we are all stressed out nowadays because of one or another thing, and it is unavoidable. So, can stress impact the hair health?
Yes, yes, stress can impact. There is stress is there. So what happens? There is something called matrix cells which has to divide, proliferate, and the hair has to start growing. So what the stress does, again, there is changes in your cortisol levels. There is increased cortisol levels. Then all these stress which leads increased cortisol, so that will lead to uh, hair loss again. So so you have to keep your stress under
Yeah.
control. How to put that? Your lifestyle management again, your mindfulness, your yoga practice, or some calming exercise that keeps your stress under control. That will reduce your hair loss.
So, doctor, now my favorite part. Can you give us some healthy tips for healthy hair?
So tips would be, yes, at least twice a week wash your scalp. So your dandruff is also under control. You see there is a dandruff, please consult your dermatologist. They'll put you on some kind of shampoos or few other medications that will keep that under control. Have a proper good sleep, proper 8 hours of sleep. Keep your stress under control. Have a proper balanced diet inclusive of all kinds of fruits, vegetables, meat, fish, eggs, sprouts, dry fruits and stuff. So, other than that, using one more main reason for hair loss nowadays is all kinds of hair treatments what we are going through. A
Yeah.
lot of ironing, straightening, blow dry, a lot of hairstyles, traction kind of hairstyles. Like we are pulling the hair, tight ponytails, so hair products, whatever you're using, heat treatments that you're doing. So all these also has to be less as much as possible. Avoid doing this. Blow dry, yes, you can do it, but not with the heat blow dry. Use a normal room temperature air to blow your hair. Keep your blow dryer a little far from your hair, like around 10 centimeters, so that will not damage or cause brittleness or frizziness on your hair. Use your heat resistant serums before doing all these treatments.
Mhm.
Yes, and even then, if you are having a lot of hair loss, do consult your dermatologist. After examination, they would be a better person to recommend what kind of treatment you are supposed to use and for how long you're supposed to do that.
That's very interesting, and I think this discussion was very informative, doctor. So, can we take some live audience questions?
Yeah, yeah, sure.
Hi, doctor. I'm from Hyderabad, and I want your appointment. Can you tell me how to take your appointment? And also, I have endogenic alopecia. I have tried everything, but nothing is working. Is there any solution for people with endogenic alopecia?
See, androgenetic alopecia, yes, can be treated. It depends what kind of treatment you have used and have you followed all the instructions given by the doctor for how long you have used those medications. And have you skipped the medications in between or anything else, extra added things which are leading to hair loss and all. So I do practice in Nalaganda. The clinic is called Tricare.
Mhm.
Anytime you can give a call and take an appointment.
Yeah, you can also Google with Tricare and doctor's name. You'll find the details. Okay. Another question is, hi doctor. Someone told me that PRP can help the hair grow back. So can I go for PRP and what is it?
Yes, PIP will help in increasing the hair density. It's called platelet-rich plasma. Your own blood will be drawn around 16 ml. that
Mm-hmm.
will be processed through a method called centrifugation, and that will be injected back into your scalp. This is a monthly once treatment.
Mm-hmm.
It depends on what kind of hair loss you are going through, hair fall, hair loss. Along
Mm-hmm.
with other medical line of treatment, this will act as adjuvant treatment. It will surely help in increasing the hair growth, hair density.
Mm-hmm. Okay. Okay, another, I'll just quickly take one last question because we are running out of time. Hi, doctor. My daughter is having gray hair and she is just 12 years old. Why she's having gray hairs at such a young age, and can we control it or stop it?
Yes. See, graying of hair at the age of 12, we call it as premature graying or canitis, pre-canitis. This is a sign that maybe she is deficient in few nutrients like vitamin B12, iron, folate. So there are oral supplements which are advisable for graying of hair. You can consult a dermatologist. They would prescribe few oral supplements that can be given, and yes, it will surely control the hair graying of hair.
Okay, so that means even young people can have gray hair. It
Yeah,
is.
that we call it as premature grain, which is not a very good thing. Most of the
Yeah.
time, there will be nutritional deficiencies happening that is
Mm-hmm.
leading to grain. So, a long-term supplements of nutrients would help in reducing the grain.
Okay. So, doctor, finally, would you like to give any take-home message or any other suggestion to our viewers today?
So, your lifestyle management, stress management, along with proper balanced diet, would help in keeping your hair fall under control. Even after doing all these things, you are undergoing hair, you are still noticing hair fall or hair loss. Please do consult a dermatologist and take their opinion instead of doing self medication. This would be a better thing. They will advise you how to use the medication in a right way for right period of time, so you'll surely get good results with that. Also, it's not just always genetic kind of hair loss or some nutritional deficiency. There are multiple other kinds of hair
Yeah.
loss, medical, uh, what we call other medical causes
Cause
which leads
genetic
to
or
hair loss. So it's better you consult them. They would be a better person to diagnose.
yeah,
With
yeah.
that.
Instead of becoming your own doctor and spending time and money and getting frustrated and then going to the doctor, it's better to reach on time and get the treatment. So, thank you so much, doctor, for sharing so much of your expertise and answering all the questions to of our viewers today. I'm sure the viewers have found the session very helpful. And thank you so much, doctor. It was delight to have you, and thank you so much for your valuable time.
Thank you.
And yes, thank you, viewers, for joining us today and asking so many questions. And let's meet up again whenever our doctor have some more time with a new topic, and we can discuss more and create more awareness. Until then, see you again, doctor. Have a nice day.
Thank you. Bye bye.
Bye bye.